What am I pressing, this one?
Yeah.
Okay, all right. So, holy cow. That's okay. So Mike stole my words, show and tell podiatry. My lecture is not a technical lecture at all. I'm not going to show you how to read an ultrasound. I'm sure you all can read it, know what to do with it. Mine is just to tell you that we're trying to get the patient to see what's wrong with them so then they understand why we're offering the treatments that we're offering. Once they understand, then they're more engaged and they're more likely to accept your treatment. So that's what this lecture is about. So they don't really they buy the treatment, but they don't really buy the treatment. They buy what they can see. So if they can see the inflammation, and again, I'll just go back and say this, they look at the ultrasound, they don't know what they're seeing. Unless they see a baby in an ultrasound, you can actually see that. They don't know it's plantar fasciitis, they don't know it's a tendon tear. You can point it out and you can show it to them. And the fact that you're confident about, hey, look, this is what you have. This is a thickened fascia, this is a torn tendon. We need to fix this, and this is how we're going to fix it. That's what they can see. They're trusting you that what you're showing them is, yes, this in fact is what it is, and then they'll accept your treatments more. So direct pay practices, that's really what we're talking about today, is having these cash-based treatments. Maybe kind of like Joel, you go all cash. They're expecting more from their doctors. They're expecting more care. Whereas somebody who is mostly insurance-based, you're seeing 45, 50 people a day, you are rushing in and out of those rooms just to make sure you can meet your monthly quota, right? So direct pay patients, you do not need to see as many patients a day when you go all cash. You can spend time with your patients. You can do all these more involved treatments. You have all these diagnostic options. And that's really what's important with direct pay patients, is they really want that care. They're looking for premium care. Ultrasound, so I'm sure most of you have ultrasound, x-ray imaging in your practice. I know there's a handful of podiatrists around me who do have these things in their practice, but they never show the patient any of the imaging. They don't go over it with the patient. They just say, yeah, you have plantar fasciitis, and here's your pair of inserts. Call me in 3 weeks if it doesn't work. And we see all those patients. They come in and they say to us, well, yeah, they did an ultrasound, they did an x-ray, but I have no idea what it said. I didn't see it. I don't even know if they really did it. So if you make it interactive for them and you show them what's happening, they feel more involved. You're not lecturing to them. You have to stop wearing those high heels. You have to stop running. You have to stop doing this. And then they understand why you're proposing these different treatments. So again, these are kind of the most common pathologies that we see. Anything from plantar fasciitis to neuromas, stress fractures, cysts. You can use ultrasound just to see just about anything. So before we had ultrasound, patients had to kind of, like we said, imagine what the heck was wrong with them. We can say the words, but it didn't really mean much. Once they can see the inflammation, they start to understand, they get more engaged, you're actually talking to them, they see that you care about them, and they can see it in real time, right? They can actually, okay, this is your foot, here we go. When you start talking to them, they start to trust you more. So then when you go and talk about those treatments that you want to do and that treatment plan that you want to offer, then they're like, okay, yeah, I understand why I need to do that. They're more likely to proceed with those options. This is my avatar, ChatGPT. So we start to use the ultrasound to engage the patient. We can share the diagnosis visually. We can explain it in real time, what it is, why it developed, how it affects the function of the foot, and then outline that treatment plan for them. So some of the treatment options, most of this stuff is out of pocket, obviously. So shockwave, soft wave, PRP, orthotics, regenerative medicine, and laser therapy. You know, ultrasound can make them feel like medical decisions, not sales. So it's all about not wanting to sell anything. It's more like, this is what you need to invest in your treatment, this is what's going to get you better. And then we can go ahead and track the progress objectively. The images are blurry for a reason. It's not because I want you to see that there's progress, it's just you kind of get the idea. that if you monitor the healing over time, they can see that, right? So we'll have somebody come in for plantar fasciitis, we'll go ahead and we'll do shockwave treatment on them, and they're like, hey, remember you did an ultrasound before and you told me what the thickness was, can you go back and show me again that it's getting better? And we're like, yeah, we can do that, and then we'll show them. We'll compare the ultrasound from the first treatment to the sixth treatment, however many treatments we're offering them. And they can see it, and they're like, oh yeah, this is working. I need to continue to do this treatment. It's not like, well, I don't think it's working, I'm just gonna stop now. It'll help them to continue the treatment that you recommended. So again, the follow-up scan is the retention tool. It keeps them coming back. It also keeps them coming back for other treatment options, like so for other diagnoses. So if you treated them for plantar fasciitis, and now they have another foot problem, they're gonna come to you because they trust you. You got them better the first time, you engaged them, you taught them what the problem was, they're coming back again. So the follow-up scan keeps the patient coming back. They like to see the progress. Just reinforces the compliance that you need to continue this treatment in order to get 100% better. And sometimes, I'll be honest, we continue shockwave or laser therapy beyond 100% better. We tell them, look, this can come back, right? So we want to make sure this doesn't, and then we'll keep them on shockwave, or we'll keep them on a program that they can come in at any point and come and get shockwave or laser therapy. And then it really creates loyalty, that patient's loyalty forever. Again, like someone said earlier, people will refer patients to you because of that. So why does it matter in direct pay? Well, again, patients want the clarity, they want the confidence. It provides real-time visual proof of their pathology, of what their diagnosis is, and then it enhances trust and strengthens the treatment recommendation. So it really supports that show and tell model of care. In our office, we use the butterfly. I forget who you brought today for, yeah, okay. I have no disclaimer, I don't own any part of butterfly or anything. We used to have the big clunky machine that you'd wheel in and do the ultrasound. They were like 50 grand, I think, at one point. The butterfly is much easier. You just hook it up, you buy the probe, you buy the app, you hook it up to an iPad, we put it on a little cart, bring it in the room. It's very portable, very easy to use. You can technically use it with an iPhone as well, but the problem with the phone is if you're trying to show the patient, do an ultrasound guided injection, and use the probe, it's pretty difficult to do. So that an iPad on a stand works much better. But it's lightweight, I mean, it's affordable. I think Butterfly, probably all in, is probably the newest model is probably about 3 grand. So it's not expensive. And it supports the direct pay model by adding high value diagnostics to, at a really low cost. And then, I mean, honestly, it pays for itself. So for every, you know, if you do ultrasound on every patient, and again, we use ultrasound all the time on most diagnoses minus the wart and an ingrown toenail. 2 regenerative cases a month, it's paid off, right? I mean, it's a no-brainer. So again, I mean, I think this was pretty quick, I'm sorry. It improves patient understanding. It builds trust, increases the rate of conversion to the treatment plan. It provides measurable progress at follow-ups and increases patient outcomes and referrals. I think using, you know, ultrasound in your office is a no-brainer. I think the important points to take here is actually engaging the patient by showing them their pathology, showing them why you need this treatment. It just gets them to understand and trust you, and then they'll go ahead and go for those more expensive treatments in the long run. That's all.
Great. I mean, I